You're listening to Word on Health with Paul Pennington. On air and online 52 weeks of the year. Taking you behind the healthcare headlines, this is Word on Health. According to a study published in the International Journal of Eating Disorders, 30% of patients with bulimia and over 60% of patients with anorexia encountered a worsening of symptoms during the pandemic. Here, the Royal College of Paediatricians and Child Health have reported a huge rise in the cases of anorexia nervosa, a situation all too familiar to former Emmerdale actress Gemma Oaten, manager of the Eating Disorders patient support charity, SEED.
The demand for us is astronomical. Our out-of-area referrals, bearing in mind we're a whole-based charity, we help people all around the UK, but out-of-area people are coming to us, and that's gone up by 116%. And I think the one that breaks my heart in terms of statistics, it's 10 to 19-year-olds, 68% increase.
Gemma, what do you believe is contributing to the rise in cases?
An eating disorder is about control, and every single person with an eating disorder is an individual, and their reasons for presenting an eating disorder are specific to them. However, control is a massive thing, and we're living in a moment in our lives where we can't control anything. We say it's like a pressure cooker. Of being in lockdown is absolutely magnifying those who are presenting signs of an eating disorder, those who already have an eating disorder and are struggling, and those who just feel completely isolated and lost. And it's not just anorexia, it's bulimia, it's binge eating, it's overeating. Food is the symptom, it's not the cause. But unfortunately, there are ramifications around food and what we do to our bodies in a way of self-harm. And 1 in 5 people with an eating disorder will die as a direct result or by taking their own life.
I know from talking to you off microphone how important it is for people living with or affected by eating disorders to be able to get support and to talk. I understand that's how SEED, the eating disorder patient charity you're patron and manager of, came about.
It was set up by my wonderful parents whilst I was in the grips of anorexia. Unfortunately, when my anorexia developed at the age of 10, when I initially went to the doctor with mum and dad's support, I was turned away from the doctor, being told that I wasn't low enough in weight to have a problem. Cut to a year and a half later, I'm in a children's adolescent psychiatric unit on bed rest and told if I don't eat in 24 hours I'll be dead, and if I don't drink I'll be dead quicker. Sadly, that was the shape of my life for 13 years. You know, how mum and dad kept together through some of the hardest times we've ever been through is testament to their love for each other. But not all families are as close as ours and are as strong as our bond. And mum and dad were like, there must be so many families going through this. And so mum being mum, whilst I was in hospital, decided she was going to set up a support group and put a helpline in our living room. And thus began SEED. And it's just gone from strength to strength. We've got email buddy schemes, text buddy schemes, support groups, albeit online at the moment. And those are for carers, for sufferers, for carers and sufferers. We see ourselves as not a clinical service, but we are always governed medically by the professionals, and we see ourselves as that charity that bridges the gap between those who are waiting for treatment and can't get access to services, because we never want any family to go through what we did.
Finally, Gemma, with things as they are, what advice would you offer to people supporting somebody going through their journey towards recovery?
One of the big key messages that we deliver at SEED is it's about the person. Don't forget who your loved one is. They're not just an eating disorder, because what can happen is you can get sucked into this world and this void, and this is where an eating disorder is very, very clever. It is so destructive. If we talk about it as an external thing, we know it's a mental health illness, but it's the best way to describe that it's just like this inner monster. And the thing it can do for the eating disorder is to destroy everything around it. So one of the biggest pieces of advice we give is to remember the loved one. When I was going through it, you know, mum and dad would talk to me as a person, as Gemma, as their daughter. If things started to get irate and if arguments started to escalate, I know it sounds a bit daft, but we'd all hold our hand up and go, whoa, we are not letting the eating disorder tear us apart. Let's just take 5 and we'll come back and we'll start again. And then we'd come back together, we'd apologise, we'd say I love you, and we'd say each other's names, like I love you mum, and there's I love you Gemma, so that you remember what is at the heart of your family. It's not the illness. It sounds so simple, but it's so effective.
For further information on this story, log on to our website, www.wordenhealth.com. That's www.wordenhealth.com. You can find us on Facebook or follow us on Twitter, our address being @WordOnHealth. Word on Health, the award-winning health, lifestyle and wellbeing report with Paul Pennington. Word on Health, your personal prescription for your very best of health.